Lymphatic filariasis, also known as Bigfoot, is a disease that has been crippling Guyanese for decades, forcing them to lead a life of stigma, discrimination, and poverty. Although several interventions by health authorities for its elimination through mass distribution of filaria drugs, Guyana has not met the criteria for validation of elimination of the disease as a public health problem, as set out by the World Health Organization just yet. In 2019 and 2021, the Ministry of Health rolled out 2 successful mass drug administration programs across the country. In 2021, Health Minister Dr. Frank Anthony reported that 70% of the country's population were administered filaria prevention pills, which makes the country eligible for certification from the World Health Organization. Later that year, he announced the commencement of a post-MDA filaria survey, which started on October 25th in Regions 2, 3, 4, 5, 6, and 10. Among other things, the survey was aimed at assessing the acceptability, risk perception, and mass drug administration participation in select regions. Blood samples were collected from representatives from the Ministry of Health who conduct house-to-house visits for testing. Filaria test results were then communicated to each participant via text messages or calls. If anyone was confirmed positive using the rapid test, treatment commences immediately. In an interview with Nightly News recently, advisor to the minister, Dr. Leslie Ramsammy, noted that Guyana has significantly reduced the transmission of filaria, but the declaration by the World Health Organization could take some time.
We could say, yes, we have brought it down and we no longer have filaria or any other disease. But when you say officially that you are at elimination stage, that is a global certification that you receive, and you have to go through a number of things, and it takes years. So even when you reach the stage where you may have stopped the spread, you are not declared. You got to meet a certain condition over a number of years.
Dr. Ramsammy outlined that though there's a possibility that the disease could flare up should the parasite still be active, efforts to bring an end to this disease will continue.
Hopefully, in terms of mass treatment, we would have done our last one. I said hopefully that we don't have to repeat that again, but we are continuing our efforts on this.
Guyana and Brazil are said to be the only 2 countries in South America still grappling with the disease. The process of certifying elimination of filaria is done by an independent international commission established by the World Health Organization. This commission will recommend to the organization those countries that fulfill the requirements for certification, as well as advise the organization on criteria, procedures, and progress made towards elimination of filariasis transmission. The commission will also designate a panel of specialists whose members can be assigned to international certification teams. Temika Rodney reporting for the HGP Nightly News.